George Robinson, Head of Patient Engagement at Recognition Health, and I'm here with Dr. Maite Ferin, Consultant Child and Adolescent Psychiatrist at Recognition Health. Thanks so much for joining us today, Dr. Ferin.
Hello.
So today we're going to be talking about child psychiatry and covering some of the most common questions asked by parents inquiring about the children's services offered at Recognition Health. So firstly, could I just ask Dr. Ferin, what is the role of a child psychiatrist?
Right. A child psychiatrist is a psychiatrist, which means there are medical doctors who are experts in mental health, and they are experts in mental health for children and adolescents. So they specialize in treating mental health problems in this population. And because of their background in the medical field, they are experts in both physical symptoms and mental health symptoms. So they treat a variety of conditions.
I see. And what is the youngest age that you will see children?
Mm-hmm. So we can see children as young as 18 months of age. It really depends on the diagnosis and on the problem, but we have seen kids as young as 18 months, and from 18 months to up to 18 years when they transition to adult mental health service.
I see. And for these young children, what are the most common treatments for them?
Right. The main diagnosis we have for the younger kids, we have mainly ADHD and autistic spectrum disorder. And we also have kids who have behavioral problems and are classified as oppositional defiant disorder. And as long as they get older, we have more what we call internalizing disorders, which is anxiety, depression, PTSD, sometimes psychosis. And we also carry on assessing and treating adolescents with ADHD and ASD, some of whom went undiagnosed, or they weren't diagnosed when they were younger.
I see. And what are the most common treatments for these young children?
Well, the most important thing is to make a very comprehensive assessment of their not just diagnosis, but also their situation at home, at school, in the social life. So the comprehensive assessment is the most important thing. Once you've done that, then we will have a variety of tools to use with the young people and the family. So we might have one-to-one psychology treatment if you want, or psychology sessions, and we can have family therapy. We can also have treatment medication for children and adolescents. So it really depends on the disorder or the diagnosis, if you want. Also depends on the family and the child preferences, because not everyone is going to want to have medication, for instance, or there might be families who are more inclined to have family therapy or therapy for their own kids. And however, there might be adolescents who don't feel like they want to engage in sessions for psychology, and they would prefer to take a pill or to take a tablet. And it also is going to depend on the severity of symptoms. So sometimes we can have young people who are slightly depressed or slightly anxious, and then we can have psychological or sessions with them, and that would be sufficient and enough for them to improve. And there might be other times when symptoms are really serious and impacting on the young children lives, and we might need some medication. So it really depends on the specific children and situation.
I see. And what are the most common reasons for taking a child to see a psychiatrist?
Well, there are two main reasons. One is what we call behavioral symptoms, which is when kids show any type of disobedience, or they are defiant, or they are breaking rules, or they have, for instance, problems, behavioral problems at school or at home. And that would be one block of problems. And the second one would be what we call more the internalizing problems, which is young people who suffer from anxiety, low mood, depression, self-harm, suicidal ideation, and they might not express in a way that is behavioral, but they are suffering inside.
How does a parent know when to take a child to see a psychiatrist?
Well, that's a good question, because that might be a difficult one, because obviously children are quite challenging, and it's difficult, and they are developing, so it's sometimes difficult to know whether certain behaviors are what we call developmentally appropriate for the age, or there's something else going on. So sometimes some parents might see their own kids as having problems, but then thinking that these problems are normal in the group of age, and they might not see that reality is that the child is struggling. And for the older kids, when they progress into adolescence, then it's even more difficult, because adolescence is a very crucial age in which a number of changes in the brain are happening. And it's not just like changes in the brain, like there are many factors around this specific young person, such as school challenges, social factors, family factors as well. So everything that is surrounding this young person might be extremely challenging, and as a result, the young person might display some symptoms that sometimes the parents don't really know whether or not they must worry, or they need to take the kids or the young person to see a psychiatrist. So that would be, for instance, the example of an adolescent, a person who is a boy or a girl who is during adolescent years, who is becoming more isolative, more withdrawing from the family, or not engaging with the family that much. And then parents might consider whether or not the child is getting depressed, or what is going on with the child. And sometimes it might be really difficult. So my advice for these parents is, if they consider something might be going on, they should go to the GP and explain what the situation is, and then the GPs have a very good understanding of what the problems might be, and then the GPs would give some advice on what to do.
And how long does a typical appointment last?
Well, usually appointments take longer than people might think, because we want to give the families and the young people enough time for them to relax and to be able to express their own worries and to understand our message as well. So usually a first initial appointment usually lasts between 2 and 2.5 hours. However, as I said, we don't have kind of a limited time in which we need to be finished, or we usually leave the time a little bit open so that families can express and as much as they feel to. For follow-up appointments, they're usually quicker. So follow-up appointments usually take 1 hour or 45 minutes, again, depending on the difficulties and what the parents want to share with the clinician.
I see. And how many appointments are generally required?
Right. For the first initial appointment, we try to get as much information as possible for the moment that the parents and the young person meet the clinician and the psychiatrist. And usually with one initial appointment, we have most of the information, and we can give feedback to the families with our clinical impression. Okay. And then for follow-ups, it really, again, depends on the child, but also on the condition and the severity and the situation. So there might be families who need like just a couple of follow-up appointments to ensure that the treatment and the right treatment is in place. and that things are progressing in the right direction. Some other kids and families might need more appointments than that and might need more follow-up appointments. So it is difficult to say just the average, but I would say like at least one initial appointment and 2 follow-up appointments or 3. And sometimes what we try to do is engage with the GP or the local camps to see if we can then refer the child to the local NHS service.
And can the parents stay in the room throughout the appointment?
Right. We try to be with the parents from the beginning and for the parents to understand that the treatment, that both the assessment and the treatment has to consider parents as well. But during the initial assessment, we start with the parents and the young child or the adolescent. We start all together. And then there is a point in which, during the middle of the interview, I ask the parents to leave the room so that I can stay with a child or with a young person on my own. And that is going to give me a little bit of understanding of how the child feels, and also how the child reacts when he or she is away from the parents. And also gives the child and the adolescent a time to express what the worries are, because otherwise sometimes they might feel a bit intimidated by the parents, or they might need to say whatever they think the parents want to hear. So that is specific. It's a lot of time in which we are with the young person is very, very important. And then at the end of the interview is when I ask parents to come back to the room, and when I give and share my clinical impression with both the young person and the family, so that everyone is on board of what is going on.
And how do you engage with the child?
Well, I think we child psychiatrists are used to or trained to engage with different children at different ages and developmental levels. So obviously it's not the same, like a 2-year-old child and 18-year-old young person is totally not the same, right? So you have to adapt yourself to the specific age, but also to the developmental level of the child. Some kids might be quite shy or quite introverted. Some others might be quite extroverted and talkative and open to share their views with you. So you have to kind of be empathetic, be understanding with the child, and try to obviously not to intimidate the child, but leave the child express their own feelings and their own worries and what is bothering them. And for that you can do things like, again, depending on the specific profile and what the child might like, you might sit down with them to play Legos or to play cars, if it's a small child. With adolescents, they usually prefer just sit down and have a chat, like as if you were talking to an adult, but in their own developmental way. And some of the kids might refuse to engage, so you have to find a way of trying to kind of gain the confidence and try for them to like you and to feel comfortable with you. And at times it might be difficult.
Absolutely. And how involved do parents and families get with the treatment plans?
Well, usually they get very much involved. Not just, they need to first of all understand what is going on. So if we diagnose someone with autism or with ADHD, for instance, parents need to understand like the symptoms and why the young person is doing certain things. And for that, it's very important that they fully understand the whole condition. And that's why we are developing psychoeducation programs for parents to be involved in the child's care. Also for the treatment, when the child is either receiving psychology sessions or medication, parents need to see the progress that the child is making. So for psychology sessions, obviously we can't share with the parents what the child has said during the session, or we have to maintain confidentiality in that respect. But we have to kind of give some feedback to the parents so that they know what we're doing, and they can do kind of match more or less the strategy that we're creating in the clinic when they are home. In relation to medication, parents need to understand, for instance, what the medication is going to achieve. They need to understand side effects of the medication and what medication can do or cannot do, and how to measure also the improvement. And for that, we need to have regular contact with them to check that kids don't have side effects and they are progressing accordingly.
I see. And what about the school in this? Do you involve the school with the treatment?
Mm-hmm. Right. So schools, we recommend schools to be involved at all times, because children spend an awful lot of time in schools. So schools are very good resource for informing us about symptoms that they perceive in children, and some of them are not going to be seen or observed at home. So schools and teachers are really good way of telling us how the child is behaving in front of others, in front of the teachers and the authority and all that. It doesn't mean that they're going to have the same behavior as they do at home, because sometimes we have like very conflicting information between what the parents are seeing at home and what teachers are seeing, and it's totally the opposite. But sometimes that can happen as well, all right? So schools give us the information at all levels, academically, socially, how the child is perceived at school. Then once the treatment is started, schools are also very useful to let us know how the child is progressing, and then whether or not they have observed any side effects, or whether or not any of the initial symptoms that they observed are improving. And therefore, schools are very useful. We have to bear in mind that some of the medications that kids have or take last for the period of like the school time. Basically, some kids, for instance, with ADHD, they take the medication in the morning, and then by the time they arrive home, the medication wears off. So the teachers are so important, because they give us a lot of understanding of how much the medication is improving symptoms.
I see. And are your reports acknowledged by schools and GPs?
Well, generally, reports are very much appreciated by the GPs and by schools. We try that our reports are very comprehensive. I spend a lot of time on reports trying to be like as much specific of the child and detail as possible, so that we give like a whole very good understanding of what the situation is. So normally schools are very appreciative, and they sometimes they have a struggle to recognize symptoms, and then all of a sudden see what we say in the report, and they are much more able to accept that the child has in fact difficulties. And these reports are very useful for SENCOs. Some schools continue contacting with us, and when the young person has a problem, we can have meetings, teleconferences with the school, or meetings with the school to help the teachers adapt care plans and measures for that specific pupil. So I would say yes, they are very much, they are very well appreciated. Likewise with the GPs are quite strict with us. They want reports that are very comprehensive, and they are very they are very exigent in terms of they're going to ask us to provide a good understanding of the case and how we are monitoring the medication to ensure that the child is not presenting with side effects, and that we are properly following the child up.
And then, so Dr. Ferin, just for these final three questions, do you have any advice for maintaining good health in children? But also, how important is routine with children? And how important is diet with children?
Well, these three questions are very important, George. It's essential that kids maintain a very good routine in their lives. And this routine should be applied to three main areas, I would say. One is sleep, the second one is diet, and the third one is exercising. And I keep insisting that these three things are so essential to our mental health, and especially for the mental health of our kids, that they need like proper sleep if they want to have emotional and cognitive health and functioning. The diet is going to impact on our lives. For instance, diet is very much related to depression, and diets that are Mediterranean diets are linked to better mood and lower levels of depression in many studies. And then exercising is the best way of increasing attention and concentration, and is the best way of improving depressive symptoms and anxiety, especially when they are kind of long-term symptoms in young and adolescents, in young people and adolescents.
Yeah, that's excellent to hear. There is also just one other thing I wanted to touch on, and that was whether you could share any advice on helping to prepare children for returning to school now due to COVID-19.
Yeah, so kids are going to struggle a little bit to go back to routine, because some of the routines have been broken down. So especially sleep, and also the routine of getting up in the morning, going to school, and doing things in a certain pace. So probably everything has been a bit broken down for a length of time. So it's important that these routines are gradually started. The kids start going to bed at appropriate times, not very late, that they start getting up early, that they maintain more or less like a structure during the day. So they start doing like a little bit of homework, not spending too much time on devices or video games. So that is like what I would recommend, because otherwise the return to the routine is going to be a bit difficult for all of us.
Yeah, nice. Yeah, I'm sure that will be really helpful to all the public out there. The only thing that I just wanted to touch on finally was that Recognition Health, we're now offering video consultations to ensure both continuity of care for our existing patients and assessments for new patients. So if anybody has or wants any further information on that, please visit our website, www.recognitionhealth.com.
Yeah, absolutely.
And thanks so much for your time, Dr. Ferin.
Thank you, George.
Brilliant.